Get started this morning. Thank you all for joining us today. As we said in multiple, in the invitation and in multiple areas, healthcare, in good healthcare in a community. Randy's saying I have to talk louder. See, Gail, I need to get that I'm mad at my daughter voice, right? That's what I need. Quality healthcare is a vital part of any growing community, and certainly a very important part of attracting businesses to a community, attracting residents to a community, and we're fortunate that we have that in our community right here at Thompson Health. Michael Stapleton is President, Chief Executive Officer for UR Business-Thompson Health in Canandaigua, New York. He joined Thompson Health in March 2011 as Executive Vice President, Chief Operating Officer. Previously, he served as Chief Executive Officer for the Lakeside Health System in Brockport, New York. After 13 years at the University of Rochester Medical Center, Michael joined LHS as Vice President of Patient Care Services and Chief Nursing Officer in 2007. He assumed the role of CEO in December 2008. He has a passion for quality improvement, building customer loyalty, strengthening brand identity, and recruiting highly competent professionals and physicians. Michael is a fellow in the American College of Healthcare Executives. Mike and his wife, Julie, live in Penfield, New York with their 5 children, which he should get a gold star for right alone. So he is very involved in coaching several youth sports teams in Penfield, as well as sitting on the board of directors for Mercy Flight Central. He's the board chair there. School of the Holy Childhood and the Interior County United Way. He holds a master's degree in leadership in healthcare systems from the University of Rochester School of Nursing, as well as a Bachelor of Science in Nursing from St. John Fisher and a Bachelor of Arts degree in psychology from SUNY Oswego. And we are very fortunate to have him here today to speak.
Thank you very much. Well, thank you, everybody. It's great to be here with you this morning and share with you a lot of great things that are going on at Thompson Health. I hope to give you a lot of information that I hope you can actually, this can be more of a reciprocating relationship conversation, so that it's stuff that you can bring back to the businesses that you do every day, share what's happening at Thompson Health, but hopefully learn a few things that you can take back to your businesses as well. So I have a lot to share with you today. I'm going to share with you our mission and visions. Excuse me? I did turn it on. It's on. So I'm going to share with you our mission and vision statement and our strategic goals, tell you a lot about what we're doing here at Thompson Health. I'm going to share a lot of recognitions and successes. I actually just finished our town hall meetings. We do them on a quarterly basis, and we had 2 full pages of recognitions and successes so far this year, and going a little bit into 2015, so I'll share them with you. I'm going to share our economic and our community impact. Haney's, the Healthcare Association of New York State, which we obviously belong to, has done a lot of work with showing the economic impact that hospitals give in their communities. In most communities, as it is here, we are one of the largest employers. And there is a lot that we do giving back to the community. So I'm going to share some data with you that Haney's just shared with all of us. I'm also going to share patient satisfaction real quick with you through the first quarter, our financials through the first quarter, give you strategic planning updates, kind of have a little conversation about what I think is going on in the Ontario County healthcare landscape, and then I'm going to share an empathy video with you. This empathy video is what I personally believe is the most powerful video that has ever come out in healthcare. It's about 2.5 years old. It's mandatory for all associates at Thompson Health to watch this. And I think that when you see it, I think it can translate into your businesses as well. It's a 4-minute video, a powerful video. People will continuously improve the health of the residents and communities of the Finger Lakes and surrounding regions. We just went through a strategic planning process at the end of 14. This is our strategic plan for 15, 16, and 17. When you look at this mission statement and how it's different from previous mission statements, what we're doing now at Thompson Health is a focus on the entire community. Mission statements for hospitals kind of used to be in the walls of the hospital. What are we going to do inside the walls of the hospital to take care of the patients? Now, it's about improving the overall health of the communities. And through this presentation, I'll hope you see how we're doing that here at Thompson Health. Our vision statement is to be the leading community healthcare system in Western New York. I have very lofty goals, and we work with this consultant. I wanted to be the leading community healthcare system in the country. And now I have music playing on my phone. We wanted to be the leading community healthcare system in the country, and our consultant said, hold on, let's start with Western New York first, and we come back in 3 years and do this again, then we'll go to the country. Well, you'll see, particularly through the recognition slide, that I think that there's a lot of things that we are doing here at Thompson Health that pretty quickly we're going to be able to proclaim ourselves as a leading community healthcare system in Western New York. Our strategic goals are listed right here, just to kind of go over these goals a little bit with you. Our number 1 goal is to leverage the UR Medicine system. We've now been part of the UR Medicine system for almost going on 4 years. That affiliation has done given enormous benefits to Thompson Health. One of the largest benefits is simply in buying power. Being able to buy under the university's contracts has saved us millions of dollars a year in purchasing power. The university has helped us bring specialties that we have not had here at Thompson Health in pulmonary, nephrology, vascular surgery, rheumatology, palliative care, a lot of services that we can give to our community. In the past, our residents in the community had to go to Rochester because we didn't offer those services. And the university allows us a unique way to recruit those docs, because I'll speak on nephrology for a second, which is kidney docs, okay? We don't have enough volume here to support a full-time nephrologist. So when we partner with the university, we basically partner for a part-time nephrologist, so that doc is here half the time, but is also up at the university doing research, doing academics, teaching, and continuing their educational pursuits as well, because we don't have enough volume to support a full-time doc. It'd be a money loser right from the very beginning. So that's one of the huge benefits of the university. The university continues to provide us enormous benefits as we move into what's called risk-sharing contracts. We have this thing called Accountable Health Partners that we are part of, and Accountable Health Partners is having contracts with direct employers. The largest employer they contract with happens to be the University of Rochester. The second largest one happens to be Thompson Health. And so it's going to go beyond our own system into large employers in the community, providing high level of care. And basically the simplest way I can tell you how this works is it's a shared savings model. When there's savings in that contract, it is shared between AHP and the employer. And the way it is shared is by we guarantee that we're going to provide the highest quality of care at the lowest possible cost. And we're already reaping benefits from that as well. We will continue to collaborate with our physicians. That's kind of an obvious no-brainer strategic goal if you're working with a hospital. But there's a lot more to that than you think. And here at Thompson Health, the vast majority of our docs continue to be private. So we have to work with these men and women in our community to make sure we're aligned and we're on the same page. So physician satisfaction is paramount to our overall success. Thompson culture, workplace environment, we have a phenomenal culture here at Thompson Health, our CARES values. But it's important we continue to strengthen those CARES values, take those CARES values to the next level. And I'm going to tell you about a recognition that we received as one of the top 150 places to work in healthcare in the country. And the number one reason behind that is all the recognition we have for our associates. And that's a culture that started many decades ago with Linda Farchione and Sharon Pepper. Our clinical service excellence, population health, Bill Kenyon chairs our population health committee. This is the thought process of getting outside the walls of the hospital and taking care of the community. We want to focus. Mary Beer sits on our committee as well. We're partnering with many people in the community. We want to be able to make sure that we're focusing on hypertension, obesity, and other community health areas, community health issues in our community. Focusing on the social determinants of health is a very important thing, and hospitals never had a responsibility to do that. But as we move forward and we continue to work with our community health partners, it's going to be very important for us to focus on those social determinants of health. Fiscal sustainability, we are a not-for-profit community hospital, but we must have a margin. No margin, no mission. So we drive to have at least a 3.5% margin. We hit that a couple years ago. We did not hit it this past year, but we still had a very successful year. We made over $2.4 million. For a community hospital in Western New York, that is very, very good. So let me go into some of the recognitions and successes. One of the best recognitions we have is our Magnet recreditation. Magnet is the highest level of accreditation you can get from the American Nursing Credentialing Center. It is the highest stamp of approval of your nursing quality. We received that again in December of 2015. It's our actual second time that we have been reaccredited. There are only 22 hospitals in New York State that have this accreditation, and there are now only 424 worldwide. Why? Because it's all about quality. Before, you used to be able to kind of write a book, and when I say a book, the application was about this thick, and it talked about all the great things you were doing with nursing and empowering your nurses and stuff you were doing at the bedside, but it's now all about quality. And if you don't have the quality, many hospitals aren't even applying. Johns Hopkins, one of the most internationally recognized healthcare facilities in the world, didn't even reapply for Magnet because they didn't have the quality. And so we did get it. As I said, only one of 22, only one of 424 worldwide. We are the second smallest in the country that has Magnet. There is one smaller hospital in Iowa that has Magnet. But other than that, we are the smallest. And when they called us and told us about it, these were words that the Magnet surveyor used, that we are small and mighty, and a small hospital being, a great example of a small hospital being committed to quality. This is a huge, huge stamp of approval for us. Quite frankly, our competitors don't have. And it really is something that sets us off in Ontario County. We had our Joint Commission survey every 3 years. We go through our accreditation survey. This year, 5 surveyors were here for 4 days, just to show you how things change. 3 years ago, it was 4 surveyors for 3 days. And so again, they go through everything we do here at Thompson Health. And that, again, is another huge stamp of approval. Our survey was very, very positive. There was nothing related to patient safety, what's called the National Patient Safety Goals. There was a couple little things around paperwork and stuff like that. When you have somebody here for 4 days, 5 people for 4 days, they're going to find something. And that's kind of what they found. They found some of those little somethings, as we call them. For the second year in a row, we were recognized by Becker Healthcare as one of the top 150 places to work in healthcare across the country. When we received this in 2015, there were only 3 other hospitals in New York State that received this, and they were all downstate. This year, there were actually 8 of them that received it in New York State, but again, every one of them was downstate. Nobody in Western New York received this recognition. And when you look at why we received this recognition, it's because, as I mentioned earlier, our recognition that we give to our associates, our benefits, our promotion of that work-life balance. We really promote the work-life balance for our associates here. I don't want people missing their kids' sporting events because I don't want to miss my kids' sporting events. And so we want to make sure we're promoting that work-life balance for everybody. We also got recognized by the American Heart Association as a fit-friendly workplace. This was a great recognition we had because we have a self-funded insurance program right now. We did that 2 years ago, so we know how important it is that we have a healthy workforce. And by having a healthy workforce, we are driving down our own costs for our health insurance plan. In fact, this past year, our health insurance rates to our employees did not go up. And if you're on the high deductible plan, they actually went down. And that was just a simple thing that we did with Excellus 3 years ago. Our actual per member per month cost went down almost 9% with Excellus. And then they still tried to raise our rates 15%. So that was the proverbial straw that broke our back and said, we're done. We're going self-funded. Because what they tell you is you need about 1,000 covered lives to minimize the risk in a self-funded insurance program for an employer. We were right about 900 covered lives because we knew not all 1,700 of our associates were going to take part in our plan. But we took the risk, and the risk has paid off huge dividends. And all the focus and everything we have, that focus on health and wellness. We have a phenomenal partnership with the University of Rochester School of Nursing Wellness Program. About 600 of our associates now have gone through the biometric screen and have taken part in condition management classes on hypertension, on high cholesterol, weight management, stress, and others that we offer. And that has proved to be very successful. We expanded into Wayne County. We opened up an urgent care in Newark in March of this year. This is one of the only screw-ups our executive team has had when we put the business plan together for our Newark urgent care. We thought we'd see between 8 and 12 people a day for the first 3 months going into a new market. We're averaging 26. As I said to Kurt was very instrumental in opening this up. Kurt Kozen, our Chief Operating Officer, I went out and I presented to the Rotary in Wayne County, and as soon as I was done that presentation, I just saw how this community was going to embrace this urgent care, and I came back to the office, and to use a quote from a movie, I said, we're going to need a bigger boat. And there was no doubt in my mind that this was going to blow up, and it sure did. I mean, I think the second day we saw 39 patients. And so urgent, you can see how much that community, that county, needed an urgent care because there wasn't one in Wayne County. This is the first urgent care that is in Wayne County. We did some renovation in our CCC, our continuing care center. We renovated our rehab, and we renovated our rehab unit so that the vast majority of patients who go into rehab are now in private rooms. What we were hearing for the community is folks who were coming in for rehab, whether it was related to a stroke or a hip replacement or a knee replacement, they did not want to be mixed in with the skilled nursing population. They did not want a roommate who was 84 years old and had dementia. They want to be mixed with the rest of the younger rehab population. So we answered the call from our community, and we did this designation. And what's really great about that is since we have done that, is our case mix has gone up to 1.05. Our case mix used to be 0.97, and that increase doesn't seem like a lot, but for basically every 0.01 that case mix goes up, that's about $100,000 in revenue related to rehab for our CCC. So that was very important for our overall success. Finger Lakes Family Care also joined us in February. Finger Lakes Family Care is Dr. Rob Smith. Dr. Rob Smith has been a long advocate for Thompson Health, but has been a private doc. He now is employed by Thompson Health, and that's been a big strategic initiative of us of employing docs in our community. We firmly believe, and we are executing this, to the point that within about the next 18 months, 90% of all the primaries within an 18 to 20 mile radius of Thompson Health will work for Thompson Health. That's how we keep our competition from penetrating us. That's how we keep it focusing on our population and working in an integrated, well-versed, well-oiled, communicating back and forth health system. So we're very happy we've been able to execute that. Clark Meadows also had a deficiency-free survey from New York State a couple months ago. I make a point of that because I have never seen a deficiency-free anything come out of New York State. Because with all of the surveyors they have in New York State, when they come through, they're going to find something because they have to validate their job. And they found nothing in their Department of Health survey up at Clark Meadows, which was great. And we were just designated again as a leader in healthcare equality by the Human Rights Campaign, by the Health Equality Index, for how we treat our associates and how we treat our patients who are gay, bisexual, or transgender. Something we're very proud of, and that's the second year in a row that we received that. So here's the economic and community impact that I referenced from Haney's. Just to give you guys a kind of a general view of what we do, we see 209,000 outpatients a year. To kind of just put that into perspective, that's about 4,000 different individuals coming to Thompson Health on a weekly basis for outpatient appointments, outpatient visits, and outpatient tests. 26,500 people are treated in our emergency room on an annual basis. 17,000, just under 18,000 treated in our urgent care, and that number is just our urgent care at Farmington. That doesn't count our urgent care in Newark that I just referred to. And 5,600 people are treated in our hospital, admitted in our hospital, and we deliver 700 babies. We used to deliver about 550 babies. We thank Geneva General every day for closing their OB unit, because not only did we get 150 new moms and babies, we got 150 new families. Because those of you who sit in this room who are female, you know you are the decision makers when it comes to health care in your family. And if you are coming here for your OB/GYN care, guess who else is coming here? That is where your husband is coming if he needs his knee scoped. It's where your husband is coming if he's older and needs his colonoscopy. It's where your parents will end up coming when you start making decisions for your parents as well. So it's very important that we engage the female head of households in our community. This is a very important slide I want to share, and I really want to share this, and I'm very thankful for Allison for giving us the opportunity to share this, because 2 weeks ago we were down at the Inn on the Lake, and our local community leaders were there, and not one of them mentioned Thompson Health. And I was a little taken back by that, not because we want accolades or anything like that, but we are the economic engine for this community. And this slide will show that. We employ over 1,700 associates now at Thompson Health. In the next 18 months, that number will surpass 2,000. With the growth and the acquisition we're doing, that number will approach 2,000, most likely by the end of 2017. According to Haney's, we have $204 million in economic activity that is generated by our payroll and by our purchasing of goods and services. Okay, that is an enormous number. Imagine $204 million not being part of this community. $26 million in tax dollars, $9.6 million in community benefit and investment. And one part I want to give kudos to our leaders and our associates here at Thompson Health. Within that $9.6 million is $2.4 million in community benefit. And what that community benefit is the net amount of executives who serve on boards, the amount of time we invest in our community, that our associates give back to our community. That is an absolutely huge number. And all of you are small businessmen and women. We put this slide up here just to give you an idea of how hard it is these days to run a healthcare facility. Because 40% of all of our reimbursement comes from Medicaid or Medicare. And when you look at that, Medicaid pays us at 76 cents on the dollar, and Medicare is 97 cents on the dollar. So when you look at over half, almost half, of the volume you take care of, you're taking a loss on. You can imagine how much of a challenge it is to run healthcare in today's environment, which quite frankly is only getting worse, because there is enormous downward pressure on our revenue and enormous upward pressure on our expenses. And it's a challenge we live with every day as we try to provide the highest level of care to our community. Just want to share real quick with you our patient satisfaction data. Within our strategic plan, our goal is to be in the 90th percentile in the country and the 99th percentile in the New York, New Jersey region. When you look at this data, we care more about the New York, New Jersey region. I'll use the ED as an example. We care more about how we rank against Clifton Springs, Newark, Wayne, the Rochester hospitals, the Syracuse hospitals, than how we rank against an ED, say, from Dallas, Texas. I don't care how we rank against an ED from Dallas, Texas, because our community is not making a decision to go to that ED in Dallas, Texas. I care how we rank against our local competition. So you can see our ED is doing a very good job at the 78th percentile and the 94th percentile. I will tell you our physicians in the ED are ranked in the 99th percentile in the country. There is no ED physician group that has higher patient satisfaction anywhere in the country in the first quarter of 2016 than our ED physicians. And they have always been at that high level. Outpatient, 84th percentile and 92nd. Again, as I told you, we would see over 209,000 outpatients. And when we have that level of patient satisfaction in our outpatient departments, that is why we're having that level of success. We've got some work to do on the inpatient side, but the one thing I want to tell you about that yes, that is our lowest area when it comes to patient satisfaction. We are working on that. But this is one of the things that that when you guys are out in the community and you're seeing all these different report cards and all these reports on hospitals, when it comes to patient satisfaction, all they focus on is inpatient. Okay? And if you remember back to the previous slide, we take care of 5,600 inpatients a year. we take care of 209,000 outpatients. But none of that outpatient patient satisfaction goes to any of those report cards. None of the ED satisfaction for the 27,000 ED visits we see goes into any of those report cards. All they focus on is the inpatient, and we only take care of 5,600 inpatients a year. It's actually a very small portion of our business. When you look at our overall business, 65% of our revenue is outpatient, 35% is inpatient. We take care, our budget is $155 million as a health system, 65% outpatient, 35% inpatient. And you can see our practices are also at the 85th percentile and 92nd. In ambulatory surgery, which is right above us, is at the 69th percentile and the 80th. So we're well on our way to hitting our goals to be in the 90th and 99th percentile. These are our financials through the first quarter as a system. We're basically break even. We've got a $12,000 surplus to a budgeted loss of $814,000. As we continue to build our budgets in healthcare these days, with all of the invention of these high deductible plans, pretty much all community hospitals will have a budgeted loss, at least through their first quarter. And we obviously have one too. But if you look at where we are from actual to budget, and I was sharing this with Bill a couple minutes ago, last year was a disaster. The weather last year was horrendous. You remember back to January, February, March, and with that huge percentage that we do on the outpatient side, our outpatient volume was in the gutter. Because when it's a 30 below zero wind chill, 80-year-old people who need to come in for therapy and lab tests and MRIs, they don't leave their house. They don't come in. And then and people will say, well, they're going to come back. Yes, they come back, but then they're taking slots of other people who weren't scheduled a month ago when they canceled that. So we really started out really behind last year. And actually, if you look at where we are today compared to budget, compared to last year, we're about $1.4 million better than budget this year than we are last year. Now, unfortunately, Dan, I don't think your budget stood the same way at Crystal Mountain because the weather didn't cooperate with him, but this nice, warm winter really cooperated with healthcare facilities. So, sorry, Dan, but we're happy. On the hospital side, when you look at what goes into this budget, on the hospital side, our inpatient volume is actually down. Our inpatient discharges are down to budget and down year over year, and that was driven by the flu season. The flu season was actually a significant flu season, but it was all outpatient. There was very little inpatient this year in the flu season, and so when there is an inpatient, the fact that we were only down 4% is actually significant because our volume in pretty much December, January, February, and into March is driven by the flu. But the flu this year really affected the 40 to 60-year-old population, and that 40 to 60-year-old population can deal with the flu at home. If it affected the 60 to 80-year-old population, we would have been busting at the seams. And in fact, it's a good thing that we weren't because there were some days in those first 3 months we were already boarding in the ED and we didn't have any flu. So that wasn't actually necessarily a bad thing. And I told you how important outpatient is to us and why we're so excited about this year. A lot of what we did, a lot of what Kurt's done from a strategic perspective of acquiring these practices of our competitors, as I alluded to, our outpatient visits are up 18% year over year. Enormous growth. MRI alone is up 26% year over year. CAT scans over 20% up year over year. Our sleep center is up 46% year over year. Seeing a lot of growth. In our senior communities, our CCC, they're basically right on budget where they need to be from an occupancy perspective as well as a payer mix. The payer mix in the CCC and long-term care is vitally important because if you think we get paid little on the Medicaid side in the hospital, you should see how little we get paid on the Medicaid side in skilled nursing. It's deplorable what we get paid. So it's very important for us that we focus on the rehab population, the Medicare population, and the self-pay population so that we can be viable in long-term care. And Ferris Hills and Clark Meadows is exceeding occupancy budgets. Actually, Clark Meadows only has one open apartment right now. That's our enriched living. And Ferris Hills, our independent living, is at 76 to a budget of 84. And our executive director over there, Lloyd Thies, is also the executive director at the Highlands of Brighton, part of the university system, and is really coming up with creative ways. Pretty much the only apartments that are open at Ferris Hills are one-bedroom apartments. And a lot of folks don't want the one-bedroom apartments. They want the two-bedroom apartments when both spouses are still alive. So we're looking at how we can bring some of those one-bedroom apartments together and make them two-bedroom apartments. So as we continue to move forward in 2016, our strategic planning initiatives, we're going to be building a new CT scanner and an observation unit. We have to build an observation unit to deal with our capacity issues. We're licensed for 113 beds, but we only staff 76 of them. We staff 76 of them because that's the need of the community, but also so that we can maximize the number of private rooms that we have. But on any given day, we have 12 to 14 observation patients who are upstairs in those admitted beds who are not a full admit patient. They're on an observation status. And to give you an example of why it's important that we come up with a better way to move patients through our system, We get paid on average about $6,000 for an admission, but we get paid $1,600 for an observation patient. And those observation patients are just as intensive, just as busy from a nursing perspective and a physician perspective as that full inpatient. So we need to create a dedicated observation unit which will get those 12 patients out of the inpatient space, but will also allow us to increase our throughput of those patients because those patients need to go home. If a patient is on observation status, it's a rule-out MI, which means they need serial troponin levels, and that troponin level comes back at 10:30 at night and it's normal, it's time to go home. Because what happens right now is that patient is upstairs in our inpatient unit, they don't go home, the next morning comes around, and that patient who can go home is what? They're our most stable patient. And so who are the doctors and nurses taking care of first? Our most acute patients. And so that patient doesn't even get seen until 4 or 5 o'clock in the afternoon and is discharged at 6, when the reality is they're ready to go home at 10:30 the night before. And so that's how we got to improve our efficiency around our observation patients. We are continuing with all of our primary care acquisitions. As I said earlier, we are hoping that 90% of all the PCPs in a 15 to 20 mile radius of Thompson Health will be part of Thompson Health by the end of 2017. A very important strategic initiative for all of us. Leakage data is data that we now get Excelis through AHP, through our university affiliation, that will allow us to see who is leaving our system, what services are being received in Rochester. What's very important for us is, in this world of risk-based contracts, where the whole mantra is, again, deliver the highest quality of care at the lowest possible cost, we have to make sure that those services that we can deliver here at Thompson, based on acuity, is done here. Because when those patients go to Rochester, it's 2 to 3 times the cost. And we do not want stuff that can be taken care of here, leaking, as we say, up to Rochester. And because of the success of our urgent care in Wayne County, we're already aggressively looking at where are we going to put our third urgent care. And so let me just talk a couple minutes to you, tell you what I know about what's going on in the competitive environment that we're working in Ontario County. And I'll start with the Finger Lakes Health System. Jose Acevedo and I, he's the CEO at Finger Lakes Health, have a very strong relationship. A lot of us work together on a regular basis. I can't for the life of me figure out why Finger Lakes Health is not affiliating with somebody. Every single community hospital in the country is affiliating with a larger academic medical center. You have to survive. And for some reason, from the board level to the executive level, Finger Lakes Health thinks they can do this on their own. And I just don't understand it. Yes, they have a lot of money. There's all these rumors out there. They have this huge endowment. They're sitting on hundreds of millions of dollars in cash. And the fact is, from everything we've learned, it's true. They do have all that money. But you're going to burn through that money. And I can tell you the time to negotiate with a partner is not when you need them. It's when you don't need them so that you can walk away. And so I don't understand why they're not doing this. And even when they are as financially as viable as they are, why are they throwing away, in my opinion, tens of millions of dollars in savings by affiliating with a larger academic medical center? So right now, we are Switzerland with them. We're not competing with them. We're competing with every other market that's around us, but we don't cross the line at 5 and 20 as you go into Geneva. We don't go into Geneva. He's not coming into Canandaigua, so we have kind of a gentleman's agreement with that. So we have a good working relationship. We want to work much closer with them. I personally hope they end up joining the University of Rochester Medical Center because I think there's so much more that the two of us together could do to provide to Ontario County and also decrease the overall cost. If we do something we only do 100 times a year, they do something they only do 100 times a year, it should be done at one place, right? And then they do it 200 times for one area, we do it 200 times for the next, and we share services along those lines. I hope that's eventually where we get to. And as far as Clifton Springs under the Rochester Regional Health System, what I believe is going to happen with them is they just got a lot of money from the state. They got $22 million from New York State to create what they call the Clifton Springs Village. And what I think you're going to see over there at Clifton Springs is it's going to be predominantly outpatient. It's going to be an outpatient services. They are going to maintain, and they have to maintain, their inpatient psych and their inpatient detox. They are the only providers of inpatient psych services and detox in Ontario County, and it is vital to the overall success of this county that we have those psych services because they're the only ones that are providing them. Dustin Riccio is the CEO who oversees Newark and Clifton Springs. He's a young CEO. He's an emergency room doc. He's got a great attitude about him. Him and I, we are very strong competitors. We are competing for the same market, but we have a very strong professional relationship together. We meet on a monthly basis, and he's a really good guy who wants to see us work closer together. Because quite frankly, the systems in Rochester are not working closer together. And when they work closer together, the community benefits. And so we're trying to not kind of follow the path of our superiors up at the university and at RGH and trying to work together so that we can better provide for the community. So I'm now going to share this empathy video with you. Just bear with me. It's only about 4 minutes and 34 seconds, and then I will open it all up for questions. Drum roll, is it going to work? brush it and see if it works. Hit the enlarge part there in the corner. So would you agree that's a pretty powerful video? That video is awesome. I love showing that to our associates because what it does for me is it reinforces what we do every day and why we're here. And when I show that at our new employee orientation, and we typically have anywhere from 15 to 20 people in the room, and when I show that video, at least half the room's crying at the end of it. Because it's what we do. It's why we go into healthcare. It's why we want to take care of people, is to help people through situations like that. And that video alone is really what spurred a lot of the thought around our new breast imaging center across the street, our Dr. Lori Sands Constellation Breast Imaging Center, because you saw those women who were sitting there waiting because they were called back The way our system was set up before is when you came in for a mammogram, if they saw something, they did exactly that. They called you back. And somebody called you up and said, hey, we saw something on your mammogram. You're going to come back in 5 days. That 5-day wait is not acceptable. And so now within our breast imaging center, you have the choice. You can stay and wait for your results so that you don't have to be called back. And so that is something that came directly out of this video that we saw. But that is an awesome video. I hope that video can have something that can bring back to your businesses and everything else. I greatly appreciate the time to share with all of you this morning and tell you all the great things that are happening at Thompson Health. And I would be happy to answer any questions that any of you may have. And I'm going to do it the same way I do with my associates. You don't ask questions, you're not going anywhere. Shocker.
I guess my question would be with the wars we've had and the vets coming back and the problem we have with the VA.
Yeah.
You know, I myself would support a health care card given to every person coming back in the service to life and go to any doctor you want to go to.
Yeah.
How would you handle that with the increase?
So we get spillover from the VA all the time, especially when they sign that new legislation. If they can't get an appointment, they can go outside the VA system. So we do an enormous amount of work within our DI department, within our lab. We obviously take care of an enormous amount of vets on an inpatient basis. The problem I see with it is the VA's got to fix how they pay the docs too. And that's one of the biggest things, because a lot of these private docs, you'll take care of a vet, and one, you don't get paid for half the stuff you do in the first place because of how on the managed care side of it, and you also don't get paid for about 6 months until after you take care of that vet. And so that's one of the biggest challenges when you look at a lot of community hospitals that have private docs. It's difficult because the private docs, well, they take care of them out of pride, you know, and a lot of our docs, in fact, a lot of our older docs are vets themselves, and they will take care of them. But the VA system continues to be horrendously broken, plain and simple. And so anytime that we have the ability to take care of the spillover or do something, we do. As a system, we do that, and we need to continue to do that. We were actually I vividly remember, too, going over to the VA to meet with them because we want to talk about how we could partner better and we could do more. And it was literally one of our associates walking down the stairs whose husband was waiting 3 months for an MRI. And I said, we'll have it done tomorrow. We got it done tomorrow, plain and simple. You know, we got it done tomorrow. Jeffrey?
Yeah, if I could just add one thing, as a military veteran myself, retired in my case, Martin's Point is an insurance policy that we have in this area. It's very similar to a TRICARE program, and Thompson Health just signed up for that very recently. So that opens up this facility to us through our insurance carriers. That's great.
Thanks, Lloyd. Other questions, comments? Yep, Chris?
Is the Da Vinci machine still being used?
Yeah, it is still being used. It's not being used to the numbers that we budgeted for that. The main reason for that is that the overall incidence of prostatectomies, the prostate surgery, has gone down across the country. They kind of caught up with that. So the main surgeries that we're doing now with the robot are hernia surgeries and GYN surgeries. And so I think so far this year, I think we've done 32. You know, we were hoping to do about 200 a month, 200 a year, but that is going down. But through the affiliation with the university, one thing we're looking at is that they're not necessarily going to invest in more robots, but there's more docs that want to use it. And so come on down here. We've got some time and space. We've got time for the Da Vinci. We don't necessarily have the time in the OR. Our OR is very, very busy. We have very limited capacity in our OR right now. But, you know, you need your gallbladder out, single-site gallbladder surgery. The incision goes through your belly button. That's all it is. And so that a lot of our docs are doing a really good job with that. And the hernia surgery is doing it laparoscopically, is really improving the turnaround time and getting people back on their feet as well. Yes, sir.
Kind of sign on that question. You know, as you look at these real estate development projects with attracting a lot of baby boomers and older clientele, how do you monitor that? Because that could vastly change.
I sit in my office and look at what's being built out back and say thank you every day is how I monitor that. You know, I mean, that's awesome. I mean, the structure around here, and actually Reedman sat with us at the last thing, and you know, we love it. It's great. You know, that just helps bring more here. Now a lot of those folks, you know, we're seeing they're moving from Rochester and they have Rochester docs, but they'll still get their services here. They still might drive to Rochester for their PCP, but eventually that will change. And with all of our acquisitions of PCPs, we have a lot of PCPs that we're still accepting new patients. You know, but you know, a lot of 60-year-old folks who've had the same doc for 20, 25 years, they don't want to change. And quite frankly, they shouldn't change because that doc knows them better than anybody else does. But the growth has been great. It's been awesome. You know, that's our target. You know, that's our target population, is that population. So we're very happy with all of that. Other questions?
Mike, talk to the issue of electronic medical records, and I IT infrastructure expenditure?
Yeah, so this whole shift to EMRs has been an enormous challenge, plain and simple. I do believe it's better for the patients, and it's in the long run, once we optimize these EMRs, it's going to work better for everybody. But we spent about $9 million on our McKesson system, which was our electronic medical record. At that time, you might have heard in some of the papers, meaningful use dollars. The federal government kind of refunded us for hitting certain benchmarks with the electronic medical record, and we got about $5 million back from the government. So when you look at the capital outlay, we put out $4 million, on our own. Being part of the University of Rochester system now, so that we can optimize this, we are going to be migrating to the Epic system. And the Epic system, again, is it's the Cadillac model. A plug for you, buddy? Okay? It is the Cadillac model, okay? It really wasn't built for community hospitals, but now they're getting to the point that they basically have sold Epic to all the academic medical centers across the country that they can, so they're starting to look more at community hospitals. So as part to have a system-wide enterprise, we are going to migrate to this Epic model. We don't know the final cost yet. We actually have a project manager who is just doing this, but my guess right now is about $10 to $12 million, and there will be no federal initiatives behind that. So that is a $12 million capital outlay. Now, when it comes to it, I believe in the near future that every single hospital in this region will be on Epic. And if the leaders work the right way together, we will all be able to go into each other's system. And that will improve patient care in our community. Because it doesn't matter where you go or who you see, your provider will be able to see all of that information. And Tom Golisano, back in 2007, called a meeting of all the CEOs when I was out at Lakeside. Linda was there here. And basically said, you guys all need to get together and work better together. And one of the first things that came out of that was we need the same EMR. And if we're on the same EMR, we can start working together. And he had a good vision of that. It obviously didn't happen. And the competition is actually a hell of a lot worse in 2016 than it was in 2007. But being able to all be on the same system will help all of us. But the capital outlay is just astronomical. Astronomical. But it's the right thing to do.
But to that point, I did not understand that my private physician software doesn't integrate with either Epic or McKesson.
And in the future, they still won't. Because Epic, you talk about a monopoly. Epic is creating a monopoly, and Epic will not freely build the interfaces between other operating systems. McKesson will, at times, build those interfaces, but Epic will not because they don't need to. I mean, go look at the financials of Epic. It's astronomical, and it was a doc-driven thing. But even in the future, we don't know if it's the right business decision right now. So all of our employed docs are on a system called MedApp. It is a very, very good system. It works great for the docs. It works great for the office staff. Is making that transition to Epic the right decision to make? It will be the right decision to make if we can't build these interfaces and get all the data and bring it all together. Because we can't have a patient who's in one of our practices come into our ED and the ED doc doesn't have access to that practice records. Can't happen. So those are all things that we're figuring out right now, working with our board. We're all diligently sitting right here in the front row like they don't know what's going on here, but I greatly appreciate that. It's great to see a lot of familiar faces during this presentation. And I do want to we just had our annual meeting too, and I do want to recognize a lot of our board members are here. Rick Hawks, our chair. Rich Kutry actually just stepped off. Dan Fuller, Bill Kenyon just stepped off. Still on his chair emeritus. Been on the board now for 29 years, give or take a few. Paul Griswold just stepped on. Randy Farnsworth. These men and women give an enormous, enormous amount of time to our health system. I think sitting on a hospital board is probably one of the most intensive boards you can sit on, not only with the monthly meetings, but they all sit on at least 2 or 3 committees that meet every month. They give an amazing amount of time to us, and this health system is better because of it. So I greatly appreciate everything that these men and women do. Oh my God, Margaret's down here at the board. And Margaret just joined our board too.
That's not why I raised my hand.
Okay, but I'm glad you did.
Can you talk a little bit about the trend toward urgent care centers and how you manage the competition with RGH trying to lead into your
Yeah, so there's going to be a proliferation of urgent cares, not only in Ontario County, but Monroe County and everywhere else. I guarantee you within the next 2 years, you will not drive more than 10 miles without seeing an urgent care. And so I think we already got a good hard fast. We're seeing 18,000 in our urgent care up in Farmington. Quite frankly, why RGH hasn't put an urgent care right there on Main Street in that building, that I don't know how many of you drive by that, but we kind of drive by it a couple times a day going in and out of here. That parking lot is continually empty. It's the 5 same cars that are in that parking lot of the 5 people who work there. Why they haven't put an urgent care there, I don't understand. If I was in their shoes, I would have done that. But there's going to be a huge proliferation of this. Where we are at a disadvantage is that we, as a community, non-for-profit community hospital, we have to apply to what's called the CON process, Certificate of Need. So New York State basically has to bless every single thing we do. Our competition, whether it's a private entity going to open up an urgent care, can open up an urgent care in the garage of their house and run an urgent care. They don't apply to these CON rules. RGH, because they do it with what's called in their faculty group, is a for-profit umbrella under RGH. They also don't have to apply to the CON rules. So it's not a level playing field by any means. It took Kurt and the folks he worked with a good 9, 12 months to open up the urgent care in Newark. It can take our competition as much time as it takes to just staff it, and they can open it up. So that it is level playing field. And how are we going to deal with our competition? Through customer service and quality, plain and simple. We deliver the highest level of customer service and the highest level of quality. I'm not as concerned about RGH penetrating Ontario County because the market data shows that they're way down here. Us and the university are way at the top. The name recognition and the trust in RGH in Ontario County is in the gutter. Now, it was also the same, although RGH has the market in Wayne County, the University of Medicine name was actually higher. And that's how we knew we would penetrate very quickly in Newark with that urgent care, because the community was begging for choice. And there was no choice other than RGH in Wayne County. So from that standpoint, I think we'll be very successful, but we've got to continue to be on the top of our game. And if we're at the top of our game from a quality and customer service perspective, we'll keep our competition out. Yes, sir.
What's going to happen to long-term care costs as minimum wage increases?
Huge problem. Huge problem. What you're going to end up seeing is you're not going to have any CNAs. It's going to be all nurses. You're going to end up hiring some more nurses. You're not going to have the direct care providers because we're not going to be able to pay for it. Plain and simple. When we first went through, and that's why Haney's put all this stuff together. When the minimum wage negotiations, I guess you can't call them negotiations, when the governor started saying, I'm going to do this, the way Haney's advocated against this was it was a $2 billion unfunded mandate for hospitals to go up to that level. Now, obviously, we're going up to the $12.50. I'm not saying it's attainable, a lot better than 15, but it's going to be a huge challenge. Because you're also, I'll tell you, CNA, Kurt and I both started as PCTs, equivalent to CNAs. It's a hard job. It's a very hard job. And when you're making $11, $12 an hour for that job, and you could go work down the street somewhere else, for $12, $15 an hour, you're going to go do it. So it's the financial side is going to be a huge burden, but the competitive side is going to be even tough, getting qualified people if we continue to do it. But what could potentially happen with that is it's all nursing. There's no CNAs. That's what I'm afraid is going to happen with that. It's going to be a huge burden.
Thompson have any virtual treatment capabilities?
We do. We do it with psych right now. We're doing telepsych because there's such a shortage of psychiatric providers. So patients who come in inpatient for whether it may be an overdose or they come in for CHF, but they've got an active psychiatric diagnosis going on. We do telepsych with the Rochester psychiatrist to help assess their safety, either ability to go home or the need for them to be transferred to a psych inpatient facility. You'll start seeing more and more telepsych. You're seeing more telemedicine in the real rural communities. We're still only 30 miles from Rochester, so we can get the specialists down here. But when it comes to how can you start decreasing the overall cost, you're going to start seeing more and more. You're hopefully going to start seeing some of that with your primary care doc. Your kid's got a sty in their eye. There's no reason why you can't just Skype and say, got a sty in the eye. Here's the ointment that you need to go buy at CVS. So I think you'll start seeing more and more of that in the future. We're working with the university on that too. The university's coming up with a whole bunch of different telemedicine initiatives. Good question. All right, great. Thanks everybody. I really appreciate the opportunity.
When we look at all the assets that we have in the Canandaigua area and the community, I think our healthcare system is definitely considered one of those assets by far, and we're very fortunate in that way. I did not mention at the beginning of this, and Mike did know, so we didn't surprise him with this, but we are live feeding this through Facebook right now, so if any of you want to watch it later or share it later, you can also share it with your friends. It's a great presentation. Certainly the economic impact is huge. So please do that. So you could just go to the Chamber's Facebook page and watch it.
Don't send it to your friends if they release Health on RGH.
No, you might want to not do that. But thank you all for coming. I hope you have a great weekend. And I'm sure there's still some coffee over there. So if you want to grab a cup and do some more networking, you're welcome to do that. Thanks so much, everyone.